Hello, my name is Patricia Benner. I was born in August in 1942 in Hampton, Virginia. Throughout my high school years, I worked as an admitting clerk at a local hospital, which inspired me to become a nurse. I got my RN/Bachelor of Science from Pasadena College in 1964. I got my Master's of Science from University of California, San Francisco in 1970. I got my PhD from the University of California, Berkeley in 1982. I have had nursing experience on medical surgical units, coronary care units, and medical intensive coronary care units. I worked for the Visiting Nursing Association for a year. I was also a research associate and an associate professor for the University of California and San Francisco School of Nursing. I have also co-wrote numerous books and many other published articles. My nursing theory is based on the Dreyfus model of skill acquisition, novice to expert nurses. So in my theory, there are 5 stages of nursing clinical competence, starting down at a novice, to an advanced beginner, to a competent nurse, a proficient nurse, and the top of the ladder would be the expert nurse. A novice nurse is a nurse that has no previous experiences with tasks that they are expected to perform. They have a lack of experience, which means they don't have skill, so they have the inability to use discretionary judgment on their patients. They follow the rules because they don't have any nursing intuition because they lack the experience. Usually, novice nurses are the nursing students on clinical. They report to an instructor, and they are doing basic tasks and learning how to do the basics of nursing. So next on the list is the advanced beginner nurse. So they are marginally acceptable performance levels. They treat all of their patients equally important because they don't have the skills to prioritize, and they don't have the skills to know and foresee what could happen down the line with each patient. So everyone is on an equal playing field, so to speak. They follow the rules closely because, again, they don't have the nursing intuition that comes with time, and they haven't had a lot of experience practicing their skills and utilizing them and seeing different things. So they also work closely with a mentor, and the mentor provides the guidelines. So the mentor is there to help the advanced beginner be there for any questions, be there for support, lead them and show them how to be a nurse. These types of nurses need support in the clinical setting. They need help setting their priorities, which is a role that their mentor/preceptor guides them with. Their knowledge is always developing. New nurses are always learning new things on the floor and seeing things that they've never seen before. And these are the new graduate nurses, typically. Then you go to the competent nurse. This is a nurse that's been in the clinical setting for 2 to 3 years. They have now gained the ability to see their patient as a whole, and they base their care off of the long-term goals of their patient. So they can see their patient right there where their patient is now, and then they have the ability to look and see what could happen down the line, whereas the advanced beginner nurse cannot. They have a feeling of routine with their job. They're usually happy where they are, and they have feelings of mastery. Then the next one would be a proficient nurse who sees the situation as a whole and know what to expect and how to modify their plan of care when something goes wrong. And the big thing with a proficient nurse is they have the ease of the decision making due to the experience they have. So they rely on their background that they've gained through their nursing career to be able to make these decisions. Lastly is an expert nurse. They do not rely on the rules or guidelines. They have their nursing intuition, and they deeply understand most clinical problems. So they have a vast knowledge that they don't need to go and look up everything because they know it just from their years and years and years of clinical experience. So this theory relates to the person. By having categorized nursing skill levels, it makes safe care for the patients. You have nursing students. At the novice, the novices report to their instructors, and they don't do really anything out of their scope of practice. And then you have the advanced beginners, who usually are the new nurses, and they have a mentor, so that's providing safe care for their patients. You're not just going to throw a new nurse in there and expect them to know everything. You're going to give them, a lifeline. So it's creating safe care for the patients. It relates to health because the skills acquired to notice deviations of health occur over time. So it's a process. You don't just know everything. You learn as you get experience, and then you can see how your patient starts maybe deteriorating, and after a while, when you're a proficient nurse, you can know why instead of the advanced beginner not really understanding why and just knowing what to do because that's the rules. So that also evolves over the course of this nurse growth. It relates to the nurse because, it's directly relatable to all of the skills that they have and the growth of their skills and the learning curve and the continuing education and the continuing growth of skills. So it's directly related to the nurse. And it's related to the environment, specifically the relationship between all the different levels of nurses. You have the student nurses, and you have the nurses on the floor maybe that are competent and they're helping the student nurses. And then you have your advanced beginners and the relationship with their mentorship. The whole environment is everyone really needs to support each other, especially when you look at this theory, it really depends on everyone supporting each other. So there was a study done about the integrations of laptops in home care. Nurses were surveyed using the Benner scale. The sample size was 10, and they were asked to rate how they felt their use of laptops were. So the results came back, and most of them felt like they were in the beginner stage or competent, with one outlier saying she felt like an expert. So it was found that the laptops lowered the nurses' self-perceived level of expertise, and they felt less competent. So the company, the management, can then validate how the nurses are feeling, give them extra support, give them extra training, and they set up a timeline so that they could become an expert, which was after a year. So then I had a patient, and I had my preceptor with me, and he had a lot of stuff going on. He had a left TMA, which was hooked up to a wound vac. He was being treated for bacteremia. He had hypertension, CKD. He had low hemoglobin. His potassium was low. His magnesium was low. He had a graft site for his left TMA that was also hooked up to a wound vac, and he was incontinent. And I went in there, and his blood pressure was really high after we gave him 1 unit of Peckford blood cells. So I went to my preceptor, and I told her his blood pressure was higher before. We gave him his meds. It brought down. We gave him the unit of blood, and it's nice to have someone to bounce your ideas off of. I could talk to her before I went and called the vascular team to discuss getting someone up here and looking at him, because his blood pressure was over 200. It was like 220 over 115. So it's nice to have a preceptor to help you prepare when you're going to talk to the doctors or when you're going to do any new skills, like hanging blood was a new skill, so it was nice to run through the procedure with her, and it's just nice to have someone there to listen and talk to you and help you along the way, especially when you're gaining your skills, your nursing background. So my stages of clinical competence go from the novice to expert, depending on how much skill you have, and the more skill you have, the further you go down the line of my clinical competence.